The aortic valve is typically made up of three leaflets: the left, the right, and the posterior leaflet, and it opens during systole to allow blood to be ejected to the body. During diastole, it closes to allow the heart to fill with blood and get ready for another systole. If the aortic valve doesn't open all the way, it gets harder to pump out to the body, and this is called aortic stenosis. If it doesn't close all the way, then blood leaks back into the left ventricle, called aortic valve regurgitation, or aortic insufficiency. Usually, the aortic valve opens to about 3 to 4 centimeters squared, but with stenosis it can become less than 1 centimeter squared. This is usually caused by mechanical stress over time, which damages endothelial cells around the valves, causing fibrosis and calcification, which hardens the valve and makes it more difficult to open completely. This type usually shows up in late adulthood, with patients over 60 years old. Similarly, patients that have a bicuspid valve with 2 leaflets as opposed to a tricuspid with 3 are more at risk of fibrosis and calcification, since the mechanical stress that's usually distributed between 3 leaflets is now being split by 2 leaflets, and therefore they see more stress per leaflet. Another important cause of aortic stenosis is chronic rheumatic fever, which can cause repeated inflammation and repair, leading to fibrosis. In this case, the leaflets can actually fuse together, called commissural fusion, which is an important distinction from the type caused by mechanical stress over time. When the valve fuses together, or hardens, it doesn't open as easily, right? And so as the left ventricle contracts, it creates this high pressure that eventually pushes on the valve until it finally snaps open, causing a characteristic ejection click. Since the blood has to flow through a narrow opening, there's turbulence, which creates noise or a murmur, which gets initially louder as more blood flows past the opening, and then quieter as the amount of blood flowing subsides, because less remains in the ventricle. This is called a crescendo-decrescendo murmur. Since now it's harder to open and push blood past this hardened valve, the left ventricle has to generate higher pressures each time it contracts to get the same amount of blood through. To accomplish this, the left ventricle can thicken its muscles, called concentric left ventricular hypertrophy. This happens because new sarcomeres are added in parallel to existing ones. Even though you have this bulked up ventricle, the heart still might struggle to get enough blood through the narrowed opening and to the body, and ultimately to the vital organs. And that means that the person's at risk of developing heart failure, and various symptoms related to whichever organ's involved. For example, if there's a reduction in blood flow to the brain, it could lead to syncope, and a reduction in blood flow through the coronary arteries to the heart's own myocardium could cause chest pain and angina. Patients might not initially experience symptoms at rest, only during exercise, because exercise requires more blood, right? And this heart isn't able to increase blood flow through the small opening. A final complication is called microangiopathic hemolytic anemia, which is essentially damage to red blood cells as they're forced through the smaller valve, splitting them into smaller fragments called schistocytes, leading to hemoglobinuria, which is hemoglobin in the urine. Treatment is usually replacement of the valve, which often doesn't happen until after the onset of symptoms. Alright, so that was aortic stenosis. What about aortic regurgitation? Well, normally right after the ventricle pumps blood out through the aortic valve, the valve shuts and remains shut until the ventricle fills again. With aortic regurgitation, or sometimes aortic insufficiency, blood flows back from the aorta into the left ventricle during diastole, or during ventricular filling. About half of cases are caused by aortic root dilation, which is where the root dilates or gets bigger, and in doing so pulls apart the leaflets, making it harder for the valves to fit snugly together and close all the way, and letting some blood flow backward. The vast majority, about 80%, of aortic root dilations are idiopathic, which means that the cause is unknown. The remaining 20% of causes are things like aortic dissection, aneurysms, or syphilis, all of which can ultimately lead to a widened aortic root. Besides root dilation, regurgitation can also happen from valvular damage, from something like infective endocarditis, a bacterial infection of the inner lining of the heart, or again from chronic rheumatic fever. In this situation, the chronic inflammation leads to fibrosis, but instead of fusing the valve leaflets together, it makes it so that they don't form a nice seal and instead let blood leak through. Patients with aortic regurgitation will have an early decrescendo diastolic murmur, caused by blood flowing back through the valve. Since blood's leaking back from the aorta into the left ventricle, the left ventricular blood volume increases, which increases the stroke volume, or the amount that the left ventricle pumps out during contraction, or systole. More blood pumped out of the heart per squeeze requires more pressure, so systolic blood pressure increases. During diastole, though, there's less blood volume in the aorta, since some of that has leaked back into the ventricle, which means that diastolic blood pressure decreases. A higher systolic pressure and lower diastolic pressure means an increase in pulse pressure, which is just systolic pressure minus diastolic pressure. A large pulse pressure, meaning a large difference between systolic and diastolic pressure, is referred to as a hyperdynamic circulation. Patients with a hyperdynamic circulation have bounding pulses, or water hammer pulses, because the blood, which is mostly composed of water, slams like a hammer against the walls of the artery with each heartbeat. These bounding pulses can be dramatic enough that they cause head bobbing that's in tune with the heartbeat, as well as causing the capillary beds in the fingernails to pulsate, sometimes called Quincke's sign. Over time, the increase in blood volume in the left ventricle causes the chamber to grow larger, called eccentric ventricular hypertrophy. In this situation, new sarcomeres are added in series to existing ones. Just like aortic stenosis, treatment for aortic regurgitation is replacement of the valve after symptoms and left ventricular dysfunction develops. The mitral valve has two leaflets, the anterior and posterior leaflet, and together they separate the left atrium from the left ventricle. During systole, the valve closes, which means blood has just one option, to be ejected out the aortic valve and into circulation. If the mitral valve doesn't shut all the way, blood can leak back into the left atrium, called mitral valve regurgitation. During diastole, the mitral valve opens and lets blood fill into the ventricle. If the mitral valve doesn't open enough, it gets harder to fill the left ventricle, called mitral valve stenosis. Let's start with mitral valve regurgitation. The leading cause of mitral valve regurgitation, and the most common of all valvular conditions, is mitral valve prolapse. When the left ventricle contracts during systole, a ton of pressure is generated, so the blood can be pumped out the aortic valve. So a lot of pressure pushes on that closed mitral valve. But normally the papillary muscles and connective tissue called chordae tendineae, or heartstrings, keep the valve from prolapsing or falling back into the atrium. With mitral valve prolapse, the connective tissue of the leaflets and the surrounding tissue are weakened, called myxomatous degeneration. Why this happens isn't well understood, but it's sometimes associated with connective tissue disorders like Marfan syndrome and Ehlers-Danlos syndrome. Myxomatous degeneration results in a larger valve leaflet area and elongation of the chordae tendineae, which can sometimes rupture, something that typically happens to the ones on the posterior leaflet. That can allow the posterior leaflet to fold up into the left atrium. Patients with a mitral valve prolapse are usually asymptomatic, but often have a classic heart murmur, which includes a mid-systolic click, which is sometimes followed by a systolic murmur. The click is a result of the leaflet folding into the atrium and being suddenly stopped by the chordae tendineae. Although mitral valve prolapse doesn't always cause mitral regurgitation, it oftentimes does. If the leaflets don't make a perfect seal, a little bit of blood leaks backward from the left ventricle into the left atrium and causes a murmur. The mitral valve prolapse murmur is somewhat unique in that when patients squat down, the click comes later and the murmur is shorter. But when they stand or do a Valsalva maneuver, the click comes sooner and the murmur lasts longer. The reason this happens is that squatting increases venous return, which fills the left ventricle with slightly more blood, and this means that the left ventricle gets just a little bit larger. The larger leaflets therefore have more space to hang out, and as the ventricle contracts and gets smaller, it takes just a little longer for the leaflet to get forced into the atrium. Standing, on the other hand, reduces venous return, meaning a little less blood in the ventricle, and so a little less room to hang out, and so the leaflet gets forced out earlier during contraction. The other heart murmur that follows this pattern is like the one in hypertrophic cardiomyopathy. So in addition to mitral valve prolapse, other causes of mitral regurgitation include damage to the papillary muscles from a heart attack. If these papillary muscles die, they can't anchor the chordae tendineae, which then allows the mitral valve to flop back and allow blood to go from the left ventricle to the left atrium. Also, left-sided heart failure that leads to ventricular dilation can lead to mitral regurgitation as well. Because as the left ventricle dilates, it stretches the mitral valve annulus, or ring, open and lets blood leak into the left atrium. Mitral regurgitation can also be caused by rheumatic fever, an inflammatory disease that can affect the heart tissue and lead to chronic rheumatic heart disease. The chronic inflammation leads to leaflet fibrosis, which makes it so that they don't form this nice seal and instead let blood leak through. Patients with mitral valve regurgitation typically have a hollow systolic murmur, meaning it lasts for the duration of systole. Now, even though we said that left-sided heart failure can cause mitral regurgitation, it also goes the other way. Mitral regurgitation can be a cause of left-sided heart failure. With mitral regurgitation, every time the left ventricle contracts, some blood is inadvertently pumped out into the left atrium, which leads to an increased preload as that blood is again drained back into the left ventricle after contraction. It's kind of like if you were digging a hole and every time you shoveled some dirt out, half of it would fall back in. That's lots of wasted work, right? In this way, both the left atrium and left ventricle experience volume overload. To better manage this larger volume, the left side of the heart undergoes eccentric hypertrophy, where new sarcomeres are added in series to existing ones, and so it grows larger. This compensation works for a while, but eventually the left ventricle might not be able to keep up, and it can lead to left-sided heart failure. Alright, now let's switch gears over to mitral valve stenosis, which is most often again caused by rheumatic fever. In this case, instead of having inflammation cause the leaflets to not form a good enough seal, the leaflets can actually fuse together, called commissural fusion. When this happens, the normal mitral valve opening, which is about 4 to 6 centimeters squared, can narrow down to 2 centimeters squared. This makes it a lot harder for blood to flow from the left atrium to the left ventricle, and so the volume of blood in the left atrium increases, leading to higher pressures in the left atrium. Higher pressures flowing through a fibrotic valve make a snap sound when it opens, which is followed by a diastolic rumble as blood is forced through the smaller opening. A constant elevation in both blood volume and pressure in the left atrium causes it to dilate and can allow blood to back up into the pulmonary circulation, causing pulmonary congestion and pulmonary edema, which can lead to symptoms like dyspnea or difficulty breathing. All this extra blood volume in the pulmonary circulation causes higher pressures in the pulmonary circulation, or pulmonary hypertension, which can ultimately make it harder for the right ventricle to pump blood to the lungs, and over time the right ventricle can hypertrophy and ultimately fail, which is called right-sided heart failure. In addition, when the left atrium dilates, the muscle walls stretch, and the pacemaker cells that run through the walls become more irritable, increasing the risk of atrial fibrillation. During atrial fibrillation, the right and left atrium don't contract properly anymore, which allows more blood to stagnate. Since the left atrium is already pretty dilated, static pools of blood can become a major risk for thrombus formation. And if a blood clot forms, it can immediately get into the systemic circulation. Finally, thinking about the heart in relation to other structures in the chest, if the atrium dilates and gets really large, it can compress its neighbor, the esophagus, and patients might have difficulty swallowing solid foods, called dysphagia. For patients with severe problems related to mitral regurgitation or stenosis, treatment involves valve repair or surgical replacement of the valve. Thanks for watching. You can help support us by donating on Patreon or subscribing to our channel or telling your friends about us on social media. The pulmonary valve is typically made up of 3 leaflets, the anterior, the left, and the right, and it opens during systole to allow blood to be ejected to the lungs. During diastole, it closes, to let the heart fill with blood and get ready for another systole. If the pulmonary valve doesn't open all the way, it gets harder to pump out to the lungs, and this is called pulmonary stenosis. If it doesn't close all the way, then blood leaks back into the right ventricle, and this is called pulmonary valve regurgitation, or pulmonary insufficiency. Pulmonary valve stenosis is often congenital, meaning that from birth the leaflets might not be fully developed, or irregularly shaped. Pulmonic valve stenosis is often associated with congenital heart conditions like tetralogy of Fallot, which affects all 4 chambers of the heart, as well as a genetic condition called Noonan syndrome. Other times there can be mechanical stress over time, which damages endothelial cells around the valves, and causes fibrosis and calcification, which hardens the valve and makes it more difficult to open all the way. Because it's kinda hard to open, when the right ventricle tries to eject blood, it resists for a split second and then finally snaps open, and this causes a characteristic ejection click. Also, since the blood has to flow through a narrow opening, there ends up being turbulence after, which creates a noise or a murmur, which gets louder as more blood flows past the opening, and then gets quieter as the amount of blood flowing subsides, because there's less in the ventricle. This sound is described as a crescendo-decrescendo murmur. Since it's harder to open and push blood past the hardened valve, the right ventricle has to generate really high pressures, and to achieve those pressures it thickens its muscles, called concentric right ventricular hypertrophy. This happens because new sarcomeres are added in parallel to the existing ones. Even though you have this bulked up ventricle, the heart still might struggle to get enough blood through the narrowed opening into the lungs, and ultimately that means having blood get backed up, and so the person can develop right-sided heart failure. A final different complication is called microangiopathic hemolytic anemia, which is essentially damage to red blood cells as they're forced through the smaller valve, and this splits them into smaller fragments called schistocytes, which leads them to get peed out in the urine and leads to hemoglobinuria, or hemoglobin in the urine. As far as signs and symptoms go, when the blood gets backed up to the body, it can lead to distended neck veins, swelling of the ankles and feet, as well as hepatosplenomegaly, which is an enlarged liver and spleen. Since less blood's able to get into the lungs, it can also cause symptoms like cyanosis, which is blue or purple discoloration of the skin, as well as shortness of breath and fatigue, which are most notable when the body's demand for oxygen is high, like during exercise. Diagnosis is usually done with an echocardiogram, and treatment of pulmonic valve stenosis usually involves a balloon valvuloplasty, which means that a balloon is inserted and then inflated to open up the narrow valve, and ultimately allow more blood to flow through it. Alright, so that was pulmonary stenosis, but what about pulmonary regurgitation? With pulmonary regurgitation, the valve doesn't close all the way during diastole, or ventricular filling, so blood ends up flowing back from the pulmonary artery into the right ventricle. Regurgitation can happen due to valvular damage, from something like infective endocarditis, which is a bacterial infection of the inner lining of the heart. Another cause is rheumatic heart disease, where chronic inflammation leads to fibrosis, but instead of fusing the leaflets together, it makes it so that they don't form a nice seal and instead let blood leak back through. Sometimes pulmonic regurgitation can be caused by previous heart surgeries as well, like a balloon pulmonary valvuloplasty for pulmonary stenosis that opens the valve too far, or a malfunctioning prosthetic valve. In pulmonary regurgitation, since blood's leaking back from the pulmonary artery into the right ventricle, there's a diastolic decrescendo murmur. It's considered a decrescendo murmur because it starts out loudest and then becomes more quiet over time. The backflow of blood increases the right ventricular blood volume, and this therefore increases the amount of work that the right ventricle has to do during systole. So over time again, the right ventricle grows larger, a process this time called eccentric ventricular hypertrophy. In this situation, new sarcomeres are added in series to existing ones. This compensation works for a little while, but eventually the right ventricle might not be able to keep up, and this can again lead to right-sided heart failure. Initially, pulmonary valve regurgitation might cause no symptoms at all, But over time, it can lead to right-sided heart failure, which can lead to blood backing up, and symptoms like distended neck veins, swelling of the ankles and feet, and hepatosplenomegaly. Diagnosis is usually again done with echocardiogram, and treatment for pulmonary regurgitation is usually valve replacement if right-sided heart failure develops. Alright, as a quick recap, pulmonary valve stenosis is associated with congenital heart conditions like tetralogy of Fallot, and it results in the pulmonary valve not opening fully, and causes a crescendo-decrescendo murmur. Over time, it can lead to right-sided heart failure and signs of cyanosis, but can be treated with balloon valvuloplasty. Pulmonary valve regurgitation is associated with things like infection and surgeries, and results in blood flowing backwards into the right ventricle, and it can cause a diastolic decrescendo murmur. It's usually asymptomatic, but over time it can lead to right-sided heart failure, and can be treated with valve replacement. What's happening, guys? Thanks for watching that video on pulmonic valve diseases. It was kind of another cardiovascular video, which I had thought we sort of finished all of those videos, but it looks like we forgot a couple stragglers. So be on the lookout for a couple more cardiovascular videos in the near future. And if you want to learn more about this particular one, you should for sure head over to osmosis.org. Osmosis.org is like our app platform. It's really awesome. Has a bunch of flashcards and quiz questions, but also like some really awesome scheduling tools that will help you through med school and just sort of organize your life. So if you're interested in that, I would really recommend heading over there and checking it out. Otherwise, you can always support us by donating on Patreon and subscribing to our channel and following us on social media. This video was written by Simone Taylor, and it was their first video script with Osmosis, so congrats. I think it was really awesome. It was edited by Rishi and Andrea. I did the video edit. No, I did the illustration and the voiceover. Yifan did the video editing. So thank you to everyone who worked on this video. I think it was really good. Till next time, see you later. The tricuspid valve has 3 leaflets, the anterior, posterior, and medial or septal leaflets. And together they separate the right atrium from the right ventricle. During systole or muscle contraction, the tricuspid valve closes, and during diastole or heart relaxation, the tricuspid valve opens and lets blood fill the right ventricle. Tricuspid valve regurgitation happens if the tricuspid valve doesn't close completely and blood leaks back from the right ventricle into the right atrium. Tricuspid valve stenosis happens if the tricuspid valve can't open completely, and it becomes difficult to fill the right ventricle. Let's start with tricuspid valve regurgitation. Often regurgitation is due to pulmonary hypertension, which causes an increase in right ventricular pressure, which then dilates the tricuspid valve, allowing blood to go backward. Another well-known cause is rheumatic heart disease, an autoimmune reaction involving the valve leaflets causing inflammation. The chronic inflammation leads to leaflet fibrosis, which makes it so that they don't form a nice seal and instead let blood leak through. Another cause of tricuspid regurgitation include damage to the papillary muscles from a heart attack. If these papillary muscles die, they can't anchor the chordae tendineae, which then allows the tricuspid valve to flop back and allow blood to go from the right ventricle to the right atrium. There are also congenital causes, like Epstein anomaly, which is when a person's born with leaflets that are located too low and are in the ventricle, rather than being between the atria and the ventricle, which makes it hard to form a nice seal. So in all these situations, blood flows back into the right atrium during systole or heart contraction. This movement of blood can be heard as a hollow systolic murmur, because it's possible to hear blood flowing through for the duration of systole. There also might be Carvalho's sign, which is when the murmur gets louder with inspiration because the negative pressure in the chest brings more blood back into the heart, and more blood makes the murmur even noisier. Now, that extra blood that flowed backward into the atrium during systole ends up draining right back into the ventricle during diastole. This means that there's an increase in right ventricular preload. It's kind of like if you were digging a hole and every time you shoveled some dirt out, half of it would fall back in, which is a lot of wasted work. Eventually, to deal with this extra blood and extra work to pump it out, the right ventricle gets larger, a process called eccentric ventricular hypertrophy. In this situation, new sarcomeres are added in series to existing ones. This remodeling or structural change in the heart stretches the annulus, or ring of the valve, letting even more blood leak back, and actually therefore worsening the regurgitation, which is a pretty vicious cycle. This compensation works for a while, but eventually the right ventricle might not be able to keep up and it can lead to right-sided heart failure, which causes symptoms like distended neck veins, swelling of the ankles and feet, and blood backed up to the liver, causing hepatosplenomegaly. Diagnosis is usually done with an echocardiogram, and treatment for tricuspid regurgitation is usually aimed at maintaining good fluid balance. Only rarely is valve repair or replacement needed. Alright, so now let's switch gears to tricuspid valve stenosis, where the tricuspid valve doesn't open all the way during diastole or filling. This is most often caused by rheumatic fever, and if the tricuspid valve is affected, then the mitral and aortic valve are almost always affected as well. In this case, as a result of the inflammation, the leaflets can fuse together, called commissural fusion. When this happens, the normal tricuspid valve opening narrows down, and this makes it a lot harder for blood to flow from the right atrium to the right ventricle. And when that blood finally pushes open the fibrotic valve, it makes a distinctive snapping sound, which is followed by a diastolic rumble as blood's forced through the smaller opening. Since it's harder for blood to get through, blood volume and pressure increase in the right atrium. This increased right atrial volume and pressure causes it to dilate, which can result in blood getting backed up into the veins. In addition, when the right atrium dilates, the muscle walls stretch and the pacemaker cells that run through the walls become more irritable. And this increases the risk of arrhythmias, like atrial flutter and atrial fibrillation. Just like regurgitation, tricuspid valve stenosis can lead to right-sided heart failure, which again leads to symptoms like distended neck veins, swelling of the ankles and feet, and blood getting backed up to the liver, which causes hepatosplenomegaly. Finally, thinking about the heart in relation to other structures in the chest, if the atrium dilates and gets really large, it can compress its neighbor, the esophagus. And patients might have dysphagia, which is difficulty swallowing solid foods. Diagnosis is again usually done with echocardiogram, and treatment of tricuspid valve stenosis usually involves a balloon valvuloplasty, which means that a balloon is inserted and then inflated to open the narrowed valve and allow more blood to flow through it. Alright, as a quick recap, tricuspid valve regurgitation is most often due to pulmonary hypertension, but is also associated with rheumatic heart disease. On auscultation, you can hear a hollow systolic murmur, and it can usually be treated with fluid balance, but over time it can lead to right-sided heart failure. Tricuspid valve stenosis is associated with rheumatic heart disease as well, and typically also involves the mitral and aortic valves. On auscultation, you can hear a snap sound, followed by a diastolic rumble, and this can be treated with balloon valvuloplasty. Again, tricuspid valve stenosis can lead to right-sided heart failure. Hey, what's happening, guys? Thanks for watching that video on tricuspid valve diseases. I just did one on pulmonary valve diseases, so we're just trying to finish up some of the last remaining cardiovascular videos. We realized on the first time through that we missed a couple smaller ones, so now we're going back and doing some of those as well. So maybe be on the lookout for a few more, I don't know. Thanks to Miguel for writing the script on this one. I think it was their first script, so congrats. I think it was an awesome script and an awesome video. Thanks to Rishi for editing the script and Yifan for editing the video. I did the illustration and the voiceover, And obviously, if you want to check out this topic and learn a little bit more about it, you should head over to osmosis.org. We've got a ton of flashcards and quiz questions and other awesome stuff to help you sort of study and learn medicine. So if you're interested in that, you should for sure check it out. Otherwise, you can help support us by donating on Patreon and subscribing to our channel and following us on social media. Okay, I think that's it. See you later.